everyone, this is Katie and this is My Life with vEDS. Today I'm going to talk to you about something that I have started calling painxiety. Painxiety to me is that feeling you get when you have a new pain and you're anxious and you're not sure if it's serious. You're like, is this a dissected artery? Do I have internal bleeding? Is there something more serious going on inside my body, or did I just pull a muscle? This is super exhausting for me, and I'm sure that many of you have also experienced this yourself, because with vEDS, or vascular Ehlers-Danlos syndrome, like, we know we're at a higher risk for dissections and other complications like organ ruptures and crazy, scary things. So I have had this feeling a lot, and I feel like I'm doing the right thing because I'm trying to make sure that my body is okay. But it does make me feel crazy sometimes. It does make me feel like a hypochondriac. I don't always want to go to the ER to get it checked. And so I was going to share a couple stories with you, different times that I either didn't have enough painxiety, or I had too much painxiety, or I had just the right amount painxiety, but it turned out that it was nothing. Sometimes I do have to remind myself that, hey, Katie, you know you have vascular Ehlers-Danlos syndrome. You know you're at a higher risk for a dissection. It's okay to get it checked out, even though you don't want to. And it is hard because, you know, with vEDS, it could be serious. So it's a lot more difficult now that I'm diagnosed to just like let it go. Like, that's something I have a really hard time with. So before I continue with this story, if you could do me a huge favor and hit that subscribe button, that will let you know when I have new videos on vEDS, and I think you can actually set it up where you get notifications. So story number one, the time that I didn't have enough painxiety. So back in May last year, me and my fiance at the time, husband now, we're traveling, and we were going to be getting on a plane that afternoon, like an 8-hour day really, because we're going cross country. We had at the time carpeted stairs. I hate carpeted stairs. The only 2 times I've fallen downstairs, they were carpeted stairs. And I don't know if I just can't see the difference between the steps, or my proprioception is just off, which is probably a combination. But this morning, we're getting ready to go to the airport, and I fall down the stairs. When I'm falling down the stairs, I am holding my tennis shoes in one hand and I'm holding the rail in the other. So when I fell, I actually like hit one step and then turned and hit another on my butt. Like, that's where I fell, was on my butt. So it swells up pretty fast, and I had never had a rupture. So I didn't realize that it was more serious than it was. It swelled up really, really fast and it hurt. But I was like, okay, well, this isn't unexplained pain. You know, I fell down the stairs. Obviously it would hurt. And I kind of tried to put it out of my mind. So I ended up laying in the bed for a little while with an ice pack and just trying to relax before we head to the airport. And then I get up in a little while and I feel like I'm gonna pass out. And I thought I was having a panic attack. I never feel like I'm gonna pass out. It's just not something that is normal for me. I've had it happen when I had too much blood taken once. They took 12 vials when I was fasting. You know, it's just not a regular thing for me at all. But thought maybe I was having a panic attack. I got on the ground, I tried to remain calm, and we just got through it. We didn't go to the doctor, we didn't get it checked out. We were going to see my specialist and enjoy the Olympic Peninsula in Washington. So we were going to be hiking and being outside in my favorite place for like 3 or 4 days. And there was no way I wanted to ruin the vacation or miss the flight out there or whatever. So we get on the plane, and it's really hard for me to sit on my butt because one cheek is swollen to twice the size of the other one. But still, I'm like, well, it's not, I just hurt something, you know? So the whole flight, I'm like sitting kind of crooked, and it was a really miserable long flight. When we landed and got into the hotel and I took a shower, took off my clothes, and my husband's like, oh, I had a huge bruise. Very obviously deep bruise, and I still did not have enough painxiety to realize, hey, I had ruptured something. I still went hiking. because I really wanted to see a waterfall. And it had stabilized, but it was just a massive bruise, like the biggest bruise I'd ever seen in my life. It was my whole cheek up kind of towards my lower back, and then all the way down the side of my leg to my knee. It was just massive bruising, massive. And I should have had enough, I don't know, mental awareness to realize like, hey, that's some pretty serious internal bleeding. But I didn't. And I got lucky. I mean, I was stable. I was able to hike. It hurt a lot, but I was like really dedicated that I was going to do this. And I did. So when I saw my doctors later that week, they were like, oh yeah, you definitely ruptured a small artery. And I was lucky that it wasn't a bigger one. And I'm sure if it was a bigger one, I would have passed out. I'm assuming I would have passed out from blood loss. I wasn't having a panic attack. I was having a blood loss attack. And so that was something where I really didn't have enough Painxiety to realize, Katie, this is serious and you should go to the doctor and make sure you're okay. Story number 2, the overstretch. So I have a hip, and I have a problem hip. It's my right hip, and it's always popping. It always is just like I have that feeling like I need to pop it in order for it to feel better. So I'm always just having this problem with this hip. And sometimes I have some pain like around my groin from it, or I do a certain move and it feels like more like sciatic kind of, but I can never quite get it to go away. And the other day I was walking, as I do every single morning. Like the first thing I do in the morning is I eat breakfast and then I go on a walk. And that's like my body warm up for the day. I get my nice cardio workout. So I started trying to stretch recently a little bit more, and nothing aggressive, just to try to help the hip. So then later I'm getting this pain in my groin area. And I know logically that I just overstretched it, and it's nothing because I've had this pain. It's like a little bit different than it is normally, but it's not like so severe. I've had an artery dissection. I remember how severe that was, and this is not it. But for some reason, my mind cannot let go of the possibility that it could be a dissection. And so then I'm just thinking about it all day. I'm trying to like check to see if I can feel anything. And I'm like looking at it like I'm gonna suddenly have x-ray vision and I'm gonna be able to see inside my leg, which is not possible. And it's the same feeling like I wish I knew that it was nothing serious so I could just move on with my life like I used to. Before I knew I had vEDS, I was able to just get an injury and it was like, okay, well, this is irritating, but I can work through it. It's fine. I know things that can help with this. I like never thought about internal bleeding or dissections or aneurysms. And now it's like every new pain, oh my gosh, it could be a dissection. What am I gonna do? I know it's hip pain. And I spent all day trying to convince myself that I know it's just musculoskeletal hip pain, but it's really frustrating. Story number 3, chest pain. Let me preface this with I used to work a job where I went to work in the morning at 6 a.m. and I worked until 4:30 p.m. and I only worked a 4-day work week. I am super used to getting up early. It is my natural rhythm to get up around 5 a.m. and go to sleep around 10:30. It is totally normal for me and it always has been. So I've always tried to like have early morning jobs because those are the ones that make me happiest. My best schedule was working 4:30 to 2 o'clock, like 4:30 in the morning to 2 o'clock in the afternoon at a convenience store. And that was the best work schedule for me that I've ever had. So now I'm in this new job and I'm not working 4:30 in the morning or 6 o'clock. In fact, the office doesn't really open until 9. So I find things to fill my morning because I'm up anyway. So that morning I had decided I was going to clean the house. We had old carpet at the time. And I'm allergic to the animals, and I was like, I just want to get this smell out of the carpet, or the allergens. So I'm like digging through stuff that like old cleaners, and I use this like baking soda cleaner and something else. I probably should have checked whether or not I can mix those, whatever it was, but it's like one of those sprinkle things. You put it on the carpet and then you vacuum it up. So I'm doing that. And then I start having this chest pain. It hurt more when I would breathe in, but I was like, it just doesn't, to me, it seems like I was sensitive to the cleaner. So all day I'm convincing myself that it's just the cleaner and it's just my lungs and it's nothing else serious. But 6 hours later, I'm still thinking about this. I ended up calling my cardiothoracic surgeon. This is what's going on. You know, it's not really getting more severe. It's pretty stable where it is, but it does hurt when I breathe in. So of course I had to go to the hospital and get checked for an aortic dissection. I'm thinking it's probably nothing. It's probably just my lungs. You know, maybe I collapsed a lung. Maybe it's just lung pain. Maybe I have an aortic dissection. Just your mind goes with all the possibilities. What could this be? It is a really frustrating place to be. I had the scan, and before we got the results, I'm like, oh my God, what if it is an aortic dissection? Painxiety. It ended up being just pleurisy, which is lung pain. And they did figure out that the cleaner must have aggravated my lungs, and it was painful for a couple of days, but I knew, like, I felt better because I knew it was not an aortic dissection and my lungs were not collapsed, and it was like, okay, well, I can move on with my day now. But it took 6 hours for me to decide I was going to go to the emergency room. 6 hours of painxiety, just back and forth. It's nothing. Oh, it's serious. It's nothing. Oh, it could be serious. It's nothing. No, it could be serious. So that's my story with painxiety. There are countless times now since I've been diagnosed with vEDS that I've had painxiety, and I've heard from many of you that you have the same kind of thoughts that go through your mind. Like every new pain, like, is it something, is it not? And it takes a while to get comfortable after a vEDS diagnosis with that feeling. You know, you just it's hard to get to know your body enough to know whether or not you have an emergency. It's really, really difficult to get there, and I'm not always there. I've had vEDS now for 3 years, and I'm still, every once in a while, I have something that I guess I should really get checked, and that is the recommendation is if you have a new pain, to get it checked. Sometimes it's really hard to follow that advice because there's only so many times when you go to the ER and it's nothing where you start feeling like the boy who cried wolf. I hope you guys don't deal with that too. I know how frustrating it is, but I also know that every time I go to the ER and get it checked and it's nothing, I do feel better. And maybe that's just what I need to do, is just get it checked and move on with my day. Thank you everybody for watching. I hope you enjoyed this video. I hope you could relate to it. I know I've met a lot of people with this painxiety. So go ahead and hit that subscribe button for more videos about my life with vEDS and vascular Ehlers-Danlos syndrome, and we'll see you soon.